Let me thank Voto Latino, Planned Parenthood, the National Latina Institute for Reproductive Health, the Asian and Pacific Island American Health Forum for joining us today, and of course my colleague and tremendous advocate, Senator Booker. The Republican repeal of the Affordable Care Act is bad news for pretty much everyone except millionaires and health insurance industry executives. But it's especially devastating to communities of color and people living in poverty. The unfortunate reality being that there is such persistent overlap between the two. And adding insult to injury, this morning we received the administration's proposed budget for fiscal year 2018. And you can guess who takes the brunt of the cuts. Not millionaires, not real estate moguls, children in poverty, the disabled, working families trying to get ahead. The Trump budget shreds the social safety net, compounding the cuts to Medicaid that their repeal of the Affordable Care Act provides, with even deeper cuts to programs that lift millions of Americans out of poverty. We'll have many opportunities to talk about the budget in the coming days, but today we're here to discuss why repealing the Affordable Care Act reverses historic gains delivered to communities of color. In the Latino community, the gains delivered by the Affordable Care Act were striking. The uninsured rate dropped by half. In fact, Hispanics represent nearly a third of all consumers gaining coverage under this historic law. We know that people of color not only struggle with higher rates of chronic diseases and serious illnesses like cancer, but they also utilize health services far less frequently than their white counterparts. One reason for this is that they are more likely to work jobs that don't come with health benefits. Dishwashers, home health aides, cashiers. These were my neighbors growing up in a tenement in Union City. People who worked tirelessly to give their children a better life and so often put their own health on the back burner. So the ACA was about more than expanding access to health services. It also was about economic justice. Consider this. Within the first year of the law's complete implementation, so many low-income people gained coverage that it actually reversed a decades-long trend in which the distance between the haves and have-nots grew wider and wider. In short, the legislation represented the most significant anti-poverty program enacted since Lyndon Johnson's Great Society. Now, in recent days, I've been traveling the state and I've met families who depend on the Affordable Care Act, and their stories have stuck with me. I hear their voices as I think about this issue. In Burlington City, I met a young African-American mother named Samantha. She told me about her son's brush with a life-threatening asthma attack. They avoided going to the emergency room because they were uninsured. Eventually, the breathing became so bad, so difficult, she had no choice but to go to the emergency room. And the doctor told her that if she had waited any longer, her son might not have made it. She credits Medicaid expansion with saving her son's life. Or take Irma, a cancer survivor I met just a few days ago in Jersey City. 10 years ago, Irma was diagnosed with uterine cancer. In the past, she would have been blacklisted from our health insurance market for life. But the Affordable Care Act made it possible for her to regularly see a specialist at the Jersey City Medical Center. And she doesn't have to worry about lifetime limits or losing her coverage due to a pre-existing condition like cancer. Today, you'll hear more stories like these, and they represent just a fraction of the lives of real people made better by this law's historic protections. Repealing this law would mark a stunning reversal of our progress. The notion that Republicans can dismantle this landmark reform without hurting the health of our families is disingenuous and it's misleading. The truth is, when you take out $800 billion from Medicaid, everyone feels the pain. When you add 24 million people to the ranks of the uninsured, everyone feels the pain. When you send more people to emergency rooms as their only way to get health care, when you saddle consumers with higher out-of-pocket expenses and end protections against insurance company abuses for patients, everyone feels the pain. And for what? to cut taxes by $600 billion for health insurance executives and the wealthiest in our society? Not on my watch. This legislation is nothing short of a full-out assault on low-income families and communities of color. And as a senior member of the Senate Finance Committee, I plan to fight this effort tooth and nail. We cannot go back to a time and place when access to health care was a privilege granted to those who can afford it rather than a right afforded to all Americans. And in this fight, I am looking forward to my colleague being a strong voice, as he has been, Senator Cory.
Thank you very much, Senator. So I'm proud to stand here, not just with my colleague, but with individuals representing some pretty amazing organizations that have been fighting for justice for all Americans. I want to highlight some organizations that are not here: the National Urban League, In Our Own Voice, NAACP, others who lend their support to the efforts we are putting forth today. Let's be clear that this is a health care bill that Donald Trump, so-called Trump Care, is putting forward that is hurting all of Americans. And my colleagues and I have been laying out over the last days the different areas, from rural Americans and urban hospitals to rural hospitals, all the ways in which this health care bill is hurting all of Americans. But today we are focusing in specifically on minority Americans. And we see, as representatives here from the Asian and Pacific Islander American community and from the Latino community, will talk specifically about what this bill will do to the advances gained under the Affordable Care Act, under Obamacare. The uninsured rate, for example, amongst API community was cut by more than half. The uninsured rate for Latinos dropped by 1/3. But I want to take just a moment to focus on the African American community, because to me, clearly, we have yet another example where Donald Trump made commitments to our country that he has not fulfilled. Now, understand what has happened in this country. In the time when we have steep disparities in health care amongst white Americans and minority Americans, the Affordable Care Act has made tremendous gains in closing that gap. For example, because of the ACA, the inequity in uninsured rates for African Americans and white children has nearly been eliminated. This is the dream put forth by our forefathers and mothers, that this idea that in this country, no matter how you're born, no matter what the circumstances, no matter what your race, you will have equal access to opportunity. And healthcare is critical to that. So the accomplishments we've made under the Affordable Care Act are incredible. And now we have a president that offensively stood before African American communities with an agenda in his head, but what he said to black communities across this country is those words: what do you have to lose? Donald Trump said, what do you have to lose? Support me, in a way that was castigating communities as if things were so bad and so challenging, not giving any light to the gains that was made in those communities under the previous president. Well, clearly now, with the Trump agenda, it is exposed. We know in African American communities what we have to lose: resources for job training. We know in the African American community what we have to lose: resources for education. We know in the African American community what we have to lose: resources to clean up toxic environments. But clearly, if Donald Trump asked the question, what do African Americans have to lose under their leadership? It is health care. What Donald Trump is doing in these craven cuts, what he is doing amounts to millions of African Americans now at risk for losing care or having it out of reach because of the abhorrent rise in expenses. And this is the problem. If you drill down on the unique challenges facing African Americans and other minorities, you often see big disparities in health outcomes. And I say health outcomes because the data shows that African Americans don't necessarily get sick more, but often they don't get equal access to treatment. That's what access to health care is so important. For example, black women have 14% higher cancer death rates than white women. despite a 6% lower incident rate of cancer. Critical to minority communities is often having access to treatment, having access to preventative care. And what Donald Trump is doing through his craven healthcare legislation is constricting that access and denying that care. Take one more example, which is just Planned Parenthood. Overrepresented by their percentage of the population using Planned Parenthood is African American women, because it is one of the critical points of access that they have to cancer screenings and other preventative care. And so those words of Donald Trump's hauntingly hang in the air. What do you have to lose? Here we are roughly 4 months into his administration, and he has actually shown clearly the many things that he is trying to undermine, the progress he's trying to stop and roll back. What do you have to lose, he asks? Well, now he answers his own question: access to health care. Ladies and gentlemen, I want to bring now the Senior Director of Government Relations and Policy from the Asian and Pacific Islander American Health Forum, Amina Farhadi.
Thank you, Senators Booker and Menendez, for bringing us together today to give voice and space to the uncertainty, the anxiety, and the fear that is palpating through communities of color across the country as we look ahead to what the future of the Affordable Care Act is. Since the Affordable Care Act became law, the law has been nothing short of life-changing for Asian American communities who have seen their uninsurance rates drop by more than half, for Native Hawaiian and Pacific Islander communities who have seen their uninsurance rates drop by nearly half. Thanks to the Affordable Care Act's tax credits, Medicaid expansion, and protections against pre-existing conditions, more in our communities have coverage that they can rely on than at any other point in history. Repealing the Affordable Care Act, however, would put all of these gains in jeopardy. Immediately, coverage for an estimated 2 million Asian Americans, Native Hawaiians, and Pacific Islanders could become in jeopardy. Coverage that people are counting on to be able to afford their medications and see a doctor. This includes people like Jirapan, a single mom in Atlanta, Georgia, who's doing what she can to raise her child. Jirapan went for years without coverage before the Affordable Care Act, but thanks to the law, she was finally able to get coverage and afford a premium that would make sense for her finances. Jirapan went to a routine screening shortly after gaining coverage, and it was there that she discovered she had breast cancer. Thanks to the Affordable Care Act, she was able to get connected to treatment, to rely on her doctor's recommendations, and to get the health care that she needed. But Jirapan's story, like so many millions of other Americans, might be vastly different if the Affordable Care Act is no longer a reality. Thanks to the Affordable Care Act, 8 million other Asian Americans, Native Hawaiians, and Pacific Islanders are relying on free preventive care that includes screenings like for breast cancer, for cervical cancer, for diabetes, conditions that disproportionately plague Asian American, Native Hawaiian, and Pacific Islander communities, and many other communities of color. Asian Americans, Native Hawaiians, and Pacific Islanders cannot afford to go back to the days before the Affordable Care Act. No American can afford to go back to the days before the Affordable Care Act. So we stand with our senators here today and we defend the Affordable Care Act and its coverage gains.
Thank you very much, Amina. Let me call on Ola Ojewomi, who is the Planned Parenthood Metro Washington's Developing Leaders Program advocate, and here we go.
Thank you so much for that introduction, Senator. I'm here today because this bill is dangerous. It targets the health of people like me, other women, other people of color, and other disabled Americans. It would leave millions without critical health insurance and would eliminate women and men's access to an essential health care provider, Planned Parenthood. By the time I was 12 years old, I became the recipient of a heart and kidney transplant only 5 hours apart. And 6 years later, as I was entering college, I was diagnosed with a post-transplant cancer. Without the Affordable Care Act, this would have been a death sentence. Instead, my pre-existing conditions didn't preclude me from getting health care. that I needed to save my life. I was able to stay on my parents' health insurance until I was 26, so I could receive the life-saving medical treatment it took to fight my cancer. Not getting shut out of health coverage ensured that I could afford my 22 pills a day, frequent hospital visits, and my wheelchair. And it ensured that I didn't have an additional burden of paying out of pocket for birth control. The reproductive rights of disabled women, especially those of color, are too often forgotten. Rampant discrimination and disproportionately low incomes limit our access to health insurance, and assumptions about our personal lives prevent schools from teaching us about sexual education. But Planned Parenthood is there. Planned Parenthood is a trusted healthcare provider that serves millions of people each year, nearly half of whom are people of color, and they're equipping us with the essential reproductive health care like birth control, STD testing, well woman exams, and early life-saving detection of cancer. Women of color often face disproportionate risks of cancer diagnosis and death. As a Black woman who just defeated my cancer, last week I've received the unfortunate news that it has returned and it's now affecting my GI tract. I know how important life-saving early detection can be. Healthcare is not a point in time. It's a lifelong need. These problems don't stop. Planned Parenthood also fills in the gaps and provides the sexual education that many disabled people were denied in schools. It provides birth control that many assume that we don't need. And it provides the health care that we deserve. I'm terrified of what will happen if this bill passes. Racism, ableism, and other forms of discrimination can limit people's opportunities and make federally funded programs like Medicaid the only option to access care. For those patients, Planned Parenthood is a critical resource and often the only healthcare provider they'll see. Without Planned Parenthood, millions would have nowhere else to go. But instead, a group of mostly white, mostly male politicians are trying to push through the worst bill for women's health in a generation, with zero input from women like me. We may be shut out of these meetings, but we refuse to be shut out of the conversations. We're going to fight to protect our lives, our care, and our right to choose our own healthcare providers. Thank you so much.
Thank you, Ola, for sharing your personal story. And I know you're going to do well. We're going to keep you in our prayers. I'm going to make sure that you have the health care that you deserve and that you want to make sure that you're healthy. But thank you for coming today and sharing your very personal story. Maria Teresa Kumar is the president and CEO of Voto Latino.
Thank you, everyone. I want to thank Senator Menendez and Senator Booker and our allied organizations that are here. That you have been incredible champions of the work that needs to be done, and we continue to seek your leadership in these difficult times. I want to be very clear. There is nothing American, healthy, or caring about the American Health Care Act. This is a ruse to transfer tax cuts for the rich on the backs of the middle class and the poor. What you have before you, in front of you, is the future of America. 60% of the 56 million American Latinos in this country, 60% are 33 years or younger. And this attacks their future. This attacks their parents' ability to be healthy and to provide. Voto Latino has been at the forefront of making sure that our community is engaged and active and enrolling. Under President Obama, we worked very closely to inform our community of its importance and its accessibility. When this was under attack on the House floor a few weeks ago, Voto Latino's audience came to the forefront and made hundreds of calls to key members of Congress in their districts. And let's be clear, we are paying attention. This assault of this administration on communities of color, whether it's changing the laws of disenfranchisement when it comes to the Voting Rights Act, whether it comes to the disenfranchisement of recreating incarceration rules or detentions, or voucher programs for our children, and now the Affordable Care Act, let's be clear what this is. It is fighting for the future that looks very different from today, and is with the help of the representatives here today, we're going to ensure that our kids are not going to be jeopardized, that they will have access to fair health care.
And our final speaker is Anne-Marie Benitez, who's the Senior Director of Government Relations for the National Latina Institute for Reproductive Health.
Good morning, everybody, and thank you to Senator Booker and Senator Menendez for welcoming me and being part of this event. I'm thrilled to join and bring to light the devastating impacts that the American Health Care Act would have on women of color today. Today, I represent 28 million Latinas in this country who are ready to fight to protect the Affordable Care Act and the health of our families and our communities. The ACA is working. In the majority of states, more than 80% of women of color ages 18 to 64 are now insured. And we just heard from everybody almost that Latinas, the uninsured rates have dropped by a third. Yet conservative lawmakers are gambling with our lives and threatening to push coverage out of reach for millions of women of color who stand to lose under the so-called American Health Care Act. The American Health Care Act includes provisions to defund Planned Parenthood from the Medicaid program, which would jeopardize women of color's access to critically important health care by limiting their access to reproductive health exams, contraceptives, cervical cancer screenings, breast cancer screenings, and the list goes on all the services that you can get at Planned Parenthood. In 2014, 23% of Planned Parenthood patients were Latinos, while 15% were Black. Our communities rely on Planned Parenthood for quality health care. We cannot afford to be cut out from this care. Personally, as a cervical cancer survivor, I know how crucial it is to catch reproductive cancers and other diseases early. And it is exactly this kind of care that Planned Parenthood provides, care that would be devastated by the American Health Care Act. In addition to defunding Planned Parenthood from the Medicaid program, this bill would roll back protections from people with pre-existing conditions, further exacerbating health disparities for women of color. The American Health Care Act would also tighten restrictions on those who receive health care tax credits, prohibiting them from purchasing health care plans that include abortion coverages, and disincentivizing insurance companies from offering plans that cover abortion care. When politicians restrict insurance coverage of abortion care, low-income families, people of color, immigrant women, and youth are hardest hit. And the bill doesn't stop there. It also decimates the Medicaid program, of which a quarter of Latinas of reproductive age are enrolled. And it erodes essential health benefit standards, which includes benefits like maternity coverage. There is no way around it. The American Health Care Act would have a devastating long-term impact on women of color's health, economic security, and progress. It is an attack on reproductive justice, a threat to health equity and the well-being of Latinos, our families, and our communities. National Latina Institute for Reproductive Health remains committed to defending the ACA and other critical health programs that ensure the right to quality, affordable health care for communities with low incomes, Latinos, and other people of color. We will continue to stand as strong as we advocate and bring voice to the need to expand health coverage, not deny it. National Latina Institute for Reproductive Health not only proud to stand with these champions, but urge senators to stand strong against any and all attempts to cut our communities off from care. For more information regarding the devastating impacts on women of color, it can be found in a fact sheet that we just released today, and we did it alongside with National Asian Pacific Women's Forum, In Our Own Voice, National Black Women's Reproductive Justice Agenda, and National Partnership for Women and Families. And the fact sheet can be found on our website. So thank you very much, and look forward to standing together on this fight.
Thank you very much.
And very briefly, just in case somebody wants, and very briefly in Spanish for our Spanish viewers. Estamos aquí hoy para denunciar los esfuerzos para anular la ley de salud que los demócratas pasaron con el presidente Obama y que le dio cobertura a más de 50% de esos latinos que no tenían ningún programa de salud. Reducimos la cantidad de personas que no tenían seguro por 50% en la comunidad latina. Un tercero de todos los nuevos consumidores de salud en este país después de la ley fueron latinos. Sabemos que nuestra comunidad tiene desproporcionadamente un efecto en enfermedades crónicas, como la diabetes, como temas de salud del corazón, también en los cánceres. Así que estamos unidos hoy con la comunidad, el senador Booker, la comunidad afroamericana, la comunidad asiático-pacífico y otros grupos para denunciar los esfuerzos no solamente de eliminar nuestra seguridad de salud, pero también el progreso económico que esa cobertura de salud dio a nuestra comunidad. With that, we're happy to answer any questions. Yes, Jonathan.
There are people of color in all 50 states. There are Latinos in all 50 states. And why is the two New Jersey senators the only ones standing up here on this kind of thing?
Because we volunteered to.
And New Jersey is the only state with two minority United States senators. So having said that, look, I think there are many others who join us in this effort. I know that in our caucus, in the Democratic caucus, there are those who are passionately committed to preserving the Affordable Care Act for all Americans, but who understand the disproportionate number, and who are making their advocacy known in many different ways. Clearly, as New Jersey's representatives, but also as representatives of national communities of color, we wanted to add our voice in a dimension that speaks to the consequences disproportionately, as Senator Booker spoke about in the African American community, as I and others have spoken about in Latino and the Asian Pacific community, of what this consequence means of repealing the Affordable Care Act. And so this is a bad deal for all Americans, but it is a particularly horrible consequence for Americans of color. John?
In the Senate, there's a push to go beyond the Medicaid cuts that the House even passed, I think, by reducing the inflationary increases for Medicaid over time. What would be your view on that? And the argument that we're hearing from Senator Toomey in Pennsylvania is that Medicaid is growing too fast for the economy. It's growing faster than the economy. We need to slow down the growth of increases. So your response to that?
Well, I always find it interesting that my colleagues, including Senator Toomey, is on the Senate Finance Committee with me, seems to have no problem cutting taxes for the wealthiest people in our society and doesn't care about the consequences to the economy in that regard. So let's have some intellectual honesty here. The reality is Medicaid expansion brought people into insurance coverage who didn't have it. And in doing so, in my view, actually saved money. Because those people prior to Medicaid expansion didn't have health care. All of us who had insurance, even more because we were paying for those who didn't have it and went to the emergency room. Not to mention the consequence of people's lives in terms of the quality of their life for waiting longer and longer as their illnesses progress until the pain or the consequences, they couldn't wait anymore and they went to an emergency room. So I reject that view as it relates to affordability. And the reality is Republican governors across the country bought into Medicaid expansion. Some of them are the most fiscally conservative individuals. So if they thought that it was unsustainable. I'm not so sure that they would have bought into it, so including in our home state of New Jersey. Any other questions? Anand?
Sorry, can I get a reaction from both of you on what happened yesterday in Manchester, about how you're concerned about threats to the U.S., New Jersey, considering what happened 20 years ago? What are your response? And en español también si es posible.
Well, this is when I was in the House of Representatives and passed the 9/11 Commission's recommendations into law, and then sat on the select committee that created the Department of Homeland Security. I said we have an incredible challenge. We have the challenge of fighting an ideology where dying is more, in the views of those individuals, where dying is actually more glorifying than trying to live. That's against everything we know in human nature. And we also have the challenge that we have to get it right 100% of the time. The terrorists only have to get lucky once to instill the terror that they do with acts like in Manchester. So we have to fight both ideology, and we have to commit ourselves to understanding that acts of terror are always possible, which is why I'm proud about the work that we have done in sharing intelligence across all agencies that has prevented many acts of terrorism here in the United States, about how our law enforcement community at all levels, federal, state, and local, have worked, and an understanding that this is a continuing challenge. So we cannot give up, and we cannot ultimately lower our guard. And certainly our thoughts and prayers are with those who were lost and their families, and with the people of England. Simplemente lo que pasó en Manchester es un recuerdo de que no podemos eliminar nuestra guardia en contra del terrorismo. Los terroristas solamente tienen que tener un éxito una vez para tratar de crear el temor que crean por un acto de terrorismo. Nosotros tenemos que tener la oportunidad de 100% del tiempo eliminar esos actos. Eso es una reta bien difícil, pero es la reta que tenemos que tratar de lograr. Pero nos recuerda de que por qué tenemos que mantener nuestra vigilancia, porque no sabemos en qué momento y en qué lugar pudiera haber un acto de terrorismo. Nuestros pensamientos están con el pueblo y las personas que perdieron a alguien en su familia en Manchester, y seguimos unidos en nuestros esfuerzos en contra del terrorismo y la ideología que actualmente promueve a alguien de pensar que morir es más glorificado que tratar de vivir.
Estoy de acuerdo con Senator Menendez. Es una situación terrible y tenemos un reto común. Inmediatamente quiero dar mis oraciones a la gente de Manchester y todos los víctimas de terrorismo en todo el mundo, porque esta situación es en Manchester, pero en África, en el Middle East, tenemos demasiados víctimas de terrorismo. So, tenemos una convicción con Senator Menendez, vamos a continuar la lucha contra esta ideología evil. Y también estamos unidos con toda la gente en el mundo, la gente de paz. Estamos unidos en esta lucha en contra de este reto. Gracias.
Senador, los reportes a los programas de los cuales ustedes acaban de hablar ahora no se limitan únicamente a esa reforma a la ley sanitaria, sino que hoy el presidente presenta su primer presupuesto oficial con unos recortes que se consideran sumamente drásticos. ¿Cómo responden ustedes a eso y cuán devastador sería para la comunidad latina y la comunidad afroamericana?
Primero de todo, a mi punto de vista, ese presupuesto está muerto aquí en el Senado. No se va a realizar. Yo creo que los cortes que el presidente quiere lograr, no solamente en programas de salud, en cortes todavía más significativos de cortes al Medicaid, a más de lo que ellos quieren hacer en rechazar la ley de salud que se pasó abajo del presidente Obama, también los cortes en la educación. los cortes en programas para las personas envejecientes, nuestros ancianos, nuestros padres y abuelos, los cortes en desarrollo comunitario, que es tan importante para nuestra comunidad, son completamente inaceptables. ¿Todo para qué? Para incrementar el presupuesto del Departamento de Defensa, con lo cual nosotros yo estoy de acuerdo con una defensa fuerte, pero nosotros lo gastamos más que los próximos 7 países en lo que se gastan en defensa en el mundo. Y número 2, para darle cortes de impuestos a los más ricos en nuestra sociedad. Aquí lo que tenemos que ayudar es la media clase y la clase trabajadora, no actualmente ayudar a esos que actualmente ya tienen gran riqueza y no tienen que recibir el beneficio de cortes de todos nosotros para que ellos puedan enriquecerse más. Así que ese presupuesto, por mi punto de vista, está muerto y yo creo que hasta algunos republicanos van a estar opuestos a ese presupuesto también. Okay.
Lo siento, estoy de acuerdo otra vez con Senator Menendez.
Normalmente estamos en acuerdo. De vez en cuando estamos en acuerdo. I don't want you to think it's a love society here. So,
I just want to ask you, you're both on the Foreign Relations Committee. What are your thoughts or your assessments so far of the President's first trip overseas that was done in the Middle East?
Senator Booker?
No? Always support my senior senator.
Yeah, okay. That gives him time to think. Not that he needs much. Look, I think it's good to build and strengthen our relationship with our allies in the Middle East and beyond. So I applaud the President for his effort. But there is a difference between the message you send in the Muslim world when you say Islamic terrorists versus Islamist terrorists. There's a difference. Words matter. Words matter. And so I worry that the message that's sent there, notwithstanding the grand and royal greeting that the President received, is misunderstood. I worry that a critical ally in our global fight against terrorism, the State of Israel, who we have an incredibly important intelligence sharing agreement with that provides critical information in that part of the world, that the President basically outed them after, he didn't have to say who it was. He could have just been silent on it, let them speculate. He basically went and outed them. Now, I can't believe it's by design, which worries me even more. And so I am worried that as we can applaud the efforts of the President to create stronger bonds with our allies in the region, that you have to pay attention to the details. You have to understand that words, maybe in the real estate industry, doesn't have meanings, but in international affairs, it is powerful. And that's a concern for me as I see the trip unfold. I hope that the rest of the trip goes well as he goes to Brussels and the NATO ally, and that's going to be incredibly important to reaffirm our commitment to NATO as well.